This patient was referred to me from the gynecologist at the 14th week of gestation. She was suspecting a large cystic area within the abdomen of the fetus. So, on the ultrasound, there was a large cystic area noted in the fetal abdomen, and this was occupying almost whole circumference of the abdomen and pushing the bowel loops and liver and other abdominal viscera anterior superiorly. There was also mild oligohydramnios, and a keyhole sign was present at the lower margin of this cystic lesion within the fetal abdomen. As you can see in this picture, keyhole sign is clearly visible. The second thing was hydroureter bilaterally, and the kidneys were showing the gross hydronephrosis. So basically, this was a distended urinary bladder with resultant gross hydronephrosis and hydroureter, and this was the case of posterior urethral valve. Posterior urethral valve is a valve-like membrane which starts from the verumentanum and fuses anteriorly distal to the prostatic urethra, and this occurs usually in 5 to 7 weeks of gestation, but is usually diagnosed after the 24 weeks of gestation. And in the antenatal period, the key signs on the ultrasound are the usually hypertrophic distended urinary bladder with keyhole sign, and there is associated gross hydronephrosis with the hydroureter and oligohydramnios. But unfortunately, these all signs are visible after the 24 to 26 weeks of gestation. In the postnatal life, the diagnosis is usually done on the micturating cystourethrogram. Like in this example of micturating cystourethrogram, the urinary bladder is thick walled with trabeculations, and keyhole sign is clearly visible. So this is another example showing the posterior urethral valve in the form of keyhole sign and distended urinary bladder. About the treatment options, there are the both antenatal as well as the postnatal treatment options. For the antenatal, there is diversion of the urine into the amniotic fluid by the catheter placement, and in the postnatal, there are the surgical options. There is transurethral ablation of the offending valve to cure this posterior urethral valve in the postnatal child. So important things on the ultrasound you have to remember is the distended urinary bladder with the hydronephrosis and hydroureter, and the second thing is the keyhole sign, and associated features are the oligohydramnios. So remember all these things to accurately diagnose the posterior urethral valve. Thank you for watching.